Tobramycin-Lotepred Drops suspension is used to treat swelling, inflammation, of the eyes and bacterial eye infections. This product contains tobramycin, an antibiotic that stops the growth of bacteria, and loteprednol, an anti-inflammatory corticosteroid that reduces swelling, redness, and itching. This medication only treats and prevents bacterial eye infections and should not be used for other types of eye infections, as it may worsen them. It is important to use this medication as directed to avoid decreased effectiveness. To apply the Tobramycin-Lotepred Drops suspension, wash your hands first and avoid touching the dropper tip to prevent contamination. Shake the bottle well before each dose. If you wear contact lenses, do not use them while using this medicine. Tilt your head back, look upward, and pull down the lower eyelid to make a pouch. Hold the dropper directly over your eye and place one drop into the pouch. Try not to blink and do not rub your eye. If your dose is for more than one drop, repeat these steps and for your other eye if directed. Your dosage is based on your medical condition and response to therapy. Do not rinse the dropper, and replace the dropper cap after each use. If you are using another kind of eye medication, wait at least 5 minutes before applying other medications. Use eye drops before eye ointments to allow the eye drops to enter the eye. Use this medication regularly at the same times each day to get the most benefit from it. Continue to use this medication for the full time prescribed, even if symptoms disappear after a few days. Stopping the medication too early may result in a return of the infection. Inform your doctor if your condition does not improve in 2 days. Some people may experience stinging or burning of the eyes for a short period of time after using this medication. You may also experience headaches while using this medication. If these effects persist or worsen, it's important to notify your doctor or pharmacist right away. It's important to remember that your doctor has prescribed this medication because they have determined that the benefits outweigh the potential risks. Many people who use this medication do not experience serious side effects. Using this medication for prolonged or repeated periods may increase your risk for new fungal eye infections and other eye problems such as glaucoma, cataracts, and delayed wound healing. It's important to not use this medication for longer than prescribed. If you experience any new or worsening eye symptoms, vision problems, or eye pain, it's important to notify your doctor immediately. While it is rare, a serious allergic reaction to this drug can occur. If you notice symptoms such as rash, itching or swelling, severe dizziness, or trouble breathing, seek medical help immediately. This is not a complete list of possible side effects. If you notice any other effects not listed here, it's important to contact your doctor or pharmacist. If you experience any side effects, you can report them to the FDA in the US or to Health Canada in Canada. Before using Tobramycin-Lotepred Drops suspension, make sure to inform your doctor or pharmacist if you are allergic to tobramycin, loteprednol, aminoglycoside antibiotics, or corticosteroids. This medication may contain inactive ingredients that can cause allergic reactions, so it's important to discuss any allergies with your pharmacist. If you have a history of other eye problems, such as glaucoma, be sure to inform your doctor or pharmacist before using this medication. After applying Tobramycin-Lotepred Drops suspension, your vision may become temporarily blurry or unstable, so it's important not to drive, operate machinery, or engage in activities that require clear vision until it is safe to do so. If you are pregnant, only use this medication if it is clearly needed, and be sure to discuss the risks and benefits with your doctor. It is unknown if this drug passes into breast milk, so consult your doctor before breastfeeding. It's important to be aware of potential drug interactions as they may alter the effectiveness of your medications or increase the risk of serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without first consulting with your doctor. If you or someone else accidentally swallows Tobramycin-Lotepred Drops suspension, it can be harmful. If someone has taken too much and is experiencing severe symptoms like losing consciousness or having difficulty breathing, it's important to seek immediate medical attention by calling 911. Otherwise, contact a poison control center right away. In the U.S., residents can call their local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control centre for assistance. Remember, it's important not to share this medication with others. This medication is specifically prescribed for your current condition, so make sure to throw away any unused medication after your treatment is completed. Do not save it for another infection unless your doctor instructs you to do so. If you are using this medication for 10 days or more, it's important to have regular eye exams to monitor your progress and check for any potential side effects. Be sure to consult your doctor for more details on this. And as always, if you have any concerns or questions about your medication, don't hesitate to speak with your healthcare provider. If you happen to forget a dose of Tobramycin-Lotepred Drops, suspension, just use it as soon as you remember. But if it's close to the time for your next dose, then just skip the missed one and use the next dose at your regular time. Don't take a double dose to make up for the missed one. When using Tobramycin-Lotepred Drops, suspension, it's important to store the bottle upright at room temperature and avoid freezing it. If the solution turns brown or cloudy, or contains particles, it should be discarded and not used. It's also crucial to keep all medications away from children and pets. When it comes to disposing of this medication, it should not be flushed down the toilet or poured into a drain unless instructed to do so. Instead, it should be properly discarded when expired or no longer needed. It's recommended to consult a pharmacist or local waste disposal company for guidance on proper disposal. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.